You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell, and I'd like to give a quick talk on things you did not know about hormones. And I find this happens a lot with estrogen. So I wanted to talk about muscle pain, stiffness, and particularly fibromyalgia. Did you know that more females than males experience fibromyalgia? Did you also know that it frequently appears during times when women experience a drop in their hormones, specifically estrogen? It's been noted that up to 80% of fibromyalgia patients are women between the ages of 30 and 50. Estrogen obviously drops in perimenopause and postmenopause. It can also occur in postpartum women who have this enormously high amount of estrogen and progesterone during pregnancy, and after birth drops like a rock, particularly if the pregnancy is after the age of 35. Other causes for low estrogen can be after a tubal ligation, discontinuing birth control pills, dieting, or even chronic stress. What else can cause drops in estrogen and that is smoking. Smokers stimulate pathways in their liver that stimulate detoxification, and the estrogen produced is frequently detoxified and gotten rid of. So if you're a smoker and you're trying to get an estrogen dose for treatment of menopause or other things, you may have to have a higher dose than other people because of the chemical changes from smoking. What does estrogen have to do with muscle, ligament, and tendon aching and pain? Well, it's well known that fibromyalgia occurs with sleep disorders. Estrogen helps provide restful and recuperative sleep. If a dream state is not reached with sleep, or if the sleep is interrupted throughout the night, the levels of growth hormone are not produced. These repair tired and achy muscles. A cycle develops. Pain causes disruption of sleep, which causes disruption of growth hormones, and repair of muscles, which causes muscle pain. And you keep going around in this cycle. A simple blood test will help you know if you might be experiencing this, and it includes checking the levels of estradiol, FSH, which is a pituitary hormone that increases if your body thinks your estrogen level is low. So it's really important to check both. And also check testosterone. Why? Ovaries, if they're not producing enough estrogen, they're probably not producing enough testosterone either. And women do need testosterone. They don't need a lot, but they need some. Testosterone strengthens the muscles and helps prevent injuries. If you are aching and stiff, think about hormones and sleep. Are you suffering needlessly when a simple adjustment of estrogen dose may be beneficial? Thanks for listening, and stay tuned for more. Talk to you soon.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.